Picture this. You go to the clinic for a simple checkup. The nurse calls you in and say your HIV test came back positive. In that moment, most people's mind goes straight to the worst place. My life is over. I will never get married. I'm going to die soon. But here's the truth. None of that has to be true anymore. By the end of this video, you will understand exactly what HIV is in plain language, how it spreads, how it really doesn't, what to do if there's an emergency, the difference between the after pill and the before pill, and how people living with HIV today get married, raise children, and grow old just like anyone else. Hello, friends and family. Welcome back to Ask Mari. I am Mariyana, your pharmacist. It's been a while we sat down together like this, so I'm really glad to be back with you. HIV is still one of the most misunderstood topics in health, so today we are clearing it all up. No big words without explanation, no shame, just facts. Let's start from zero. HIV stands for Human Immunodeficiency Virus. Long name, simple idea. Picture your immune system like the security guards protecting a building, which is your body. Every day, germs, viruses, bacteria try to sneak past those guards. HIV is a virus that specifically attacks the guards themselves. These guards are called CD4 cells. They are special cells called CD4 cells. If HIV isn't treated for many years, it can wear down enough guards that your body struggles to fight off things it normally would, like simple infection. That weakened advanced stage has a different name, which is called AIDS. But here is the part I want you to really hear. HIV and AIDS are not the same thing. Think of it like rain and flood. Rain falling doesn't mean a flood is going to come. It depends on where you live or what you do about it. Treat HIV early, and most people never reach that flood stage at all, which is the AIDS stage. Let me tell you a story. Well, let's call her Abena. Not her real name though, but her situation is one lived by thousands of women. Abena found out she has HIV at a routine antenatal test whilst pregnant with her first child. She ran to the clinic bathroom, cried and cried and cried, convinced she had somehow harmed her baby already. But then a nurse came in, saw her, sat her down, and explained something Abna didn't know. With the right treatment, started early, her baby could be born completely HIV negative. Today, Abna's daughter, Ama, is 7 years old, healthy, HIV negative, and Abna is still on her daily medication, living a normal life. I am telling you this now at this stage because I want you to hold on to that feeling, hope, as we go through the rest of this. So, how does HIV actually spread? Through specific body fluid, blood, semen, vaginal fluids, and breast milk. Most commonly through unprotected sex, sharing needles, or from a mother to her baby during pregnancy, birth, or breastfeeding if left untreated. Now, the part almost everyone gets wrong. HIV does not spread through hugging, sharing a plate of food, using the same toilet or bathroom, mosquito bites, coughing, or sitting next to someone. None of that. You cannot catch HIV from ordinary daily life, so please Don't ever isolate someone because of their status. They deserve the same warmth as anyone else. Here is something that surprises people. You can have HIV and look and feel completely healthy for years. Some people get flu-like symptoms a few weeks after the infection, fever, sore throat, body aches, and then those symptoms disappear and nothing shows again for a long time. That's exactly why testing matters so much, not because something looks wrong, but because you simply cannot know just by looking. If you are sexually active, especially with a new partner, or you do not know your partner's status, please get tested. It is quick, private, and honestly an act of self respect. Now, here's a section I want you to remember clearly because it could genuinely help someone you know. So please don't keep this. Share this video. Let's say something happened, a condom broke, or there's an accidental exposure to blood, or someone was sexually assaulted, raped. There's an emergency option called PEP, post exposure prophylaxis. Think of it like a fire extinguisher. You use it right after something goes wrong to stop the fire from spreading, right? Good. Now, timing is everything when it comes to PEP. PEP works best if started within the first couple of hours, and it must be started within 72 hours, that is 3 days after the exposure. After that window, it is no longer considered effective. Once started, it is taken every single day for 28 days without missing dose. In Ghana, based on the Ghana Health Service official guidelines, the medicine combination most commonly used for adults is tenofovir, lamivudine, and dolutegravir. The same three medications taken together that are also used for ongoing HIV treatment. Children are given specially adjusted combination based on their age and weight decided by their clinician. If this is you or someone you love right now, please go to the nearest hospital immediately. Don't wait. Don't feel ashamed. This is simply emergency medical care, the same as treating any other injury. And yes, this applies fully to children who have experienced abuse, to who have been raped, who have been sexually assaulted. When this happens, please take the child to the hospital immediately. Hospitals in Ghana have specific protocols in place to take care of them properly and compassionately. Now, PrEP before pill, pre-exposure prophylaxis. If PEP, the after pill, is the fire extinguisher, then PrEP before pill is the smoke detector you install before there's ever a fire. PrEP is for someone at ongoing high risk of HIV. For example, if your partner is HIV positive, or if you have multiple partners and don't always know their status. Taking correctly every single day, it lowers your risk of getting HIV through sex by about 99%. It doesn't protect against other infections though, so condoms are still important. They still matter alongside it. In Ghana, the main and most widely available option is a daily pill combining tenofovir with entrecitapine or lamivudine, one tablet once a day. There are newer options to a vaginal ring, a long-acting injection given every couple of months, which are recognized in Ghana's national guidelines but aren't yet widely available at most clinics. So if you are interested in PrEP, ask your clinic directly what they currently have because it varies by location. For someone already living with HIV, treatment is called ART, antiretroviral therapy. It won't remove the virus completely, but it will control it so well that it becomes a small, manageable part of someone's health, just like taking a daily pill, for example, high blood pressure. The standard treatment today in Ghana and in most of the world is one tablet once a day combination of tenofovir, lamivudine, and dolutegravir. Same three ingredients we mentioned with PEP, just for a long-term daily use instead of an emergency. One pill once a day. This is genuinely it for most people. Now, let me tell you about a couple. We will call them Kofi and Ama. Kofi found out he had HIV over a decade ago before he met Ama. When they started dating, he told her early, honestly. She did her research, spoke to a doctor, and made her own informed choice to stay. Kofi has taken his daily tablets every single day since his diagnosis. Today, doctors would say his virus is undetectable, meaning it is so well controlled. Lab tests can't even find it in his blood. Kofi and Ama have been married for years now. They have two children. Ama remains HIV negative, and none of their kids has HIV. This is not a fairy tale. It is what modern treatment makes possible. Which brings me to the single most important fact in this whole video. When someone takes their HIV medicine every day without missing doses, the amount of virus in their blood, called the viral load, can drop so low that it becomes undetectable. Lab tests simply cannot find it anymore. And here is the game changing discovery. When someone stays undetectable, they cannot pass HIV to their partners through sex. Not very unlikely. This is zero. Scientists call this U equals U. Undetectable equals untransmittable. It's one of the best proven facts in modern HIV medicine, and it is exactly how Kofi has protected Ama for all these years. Let's make this practical. To protect yourself and others, you need to know your status. Get tested. Use condom correctly and consistently. If you are at ongoing risk, ask about PrEP. Never share needles. If there is an emergency exposure, get to the hospital immediately within 72 hours for PEP. And if you are already living with HIV, take your daily medicine for your own health and to protect the people you love. One thing that hurts people living with HIV almost as much as the virus itself: how people treat them. Fear, judgment, whispered gossips. Please don't be a part of that. A diagnosis is the start of managing a health condition. It is not a verdict on someone's character or future. I'll be honest with you too. There are still places in the world and some types of jobs where outdated rules around HIV exist, even though the medical facts have moved on. That's a real ongoing conversation happening in different countries. But what science is completely clear on is that someone on treatment can be just as healthy, capable, and dependable as anyone else. Now, family, let's bust some myths quickly. You can tell someone has HIV just by looking at them. Myth. Completely false. HIV only affects certain kinds of people. Myth. HIV does not check your relationship status or your religion or your job title. If both partners have HIV, protection doesn't matter. Myth. Different strains and other infections can still be passed between partners, so protection and medical guidance still matter. Getting tested means something is wrong with you. Myth. Getting tested means you are responsible. You are taking care of yourself. That is it. Full stop. Before we close, here is what I want you to actually do with everything we've covered. Get tested regularly. It is quick, often free and confidential. If you are HIV negative and want extra protection, ask about PrEP. If you've had a possible exposure, including assault, please go straight to the hospital within 72 hours for PEP. If you are living with HIV, take your treatment consistently. It protects you and the people you love. Treat anyone living with HIV the way you would want to be treated, with compassion, not judgment. If this episode helped you understand HIV a little better, please hit the like, drop a comment, and share it. Not for numbers, but because somewhere out there someone needs exactly this information today. Maybe a sad person who has lost hope because they realize they are positive. Maybe a scared teenager who has been assaulted. Maybe you. And remember, this whole series exists because of your questions. If you've got a health question, anonymous or not, send it to maryglobeinfo@gmail.com or drop it in the comments. I read every single one of them. I am Mariyana, your pharmacist. Your health is your power. Protect it, value it, and enjoy it. I'll see you in the next episode if God permits. Bye bye for now.